I know I wanted to be in the medical field so I could take care of people. I wasn't sure which route I wanted to go in the medical field. So I researched different programs that they had, and I discovered surgical technology, and I kind of looked it up and I thought, that's pretty cool. I'm going to try to do that. And so that's how it got me into the program. And as the semesters went on, I found out I really enjoyed it. So on a day-to-day basis, we're responsible for gathering all the necessary supplies, instrumentation, equipment needed for each surgical procedure. One of the ways that we help in the OR is anticipating the surgeon's needs. My role is to make sure that we have everything for the case. I have to set up for the case, and then the nurse is waiting for me to do all that so we can count every single item on the table to make sure that we don't lose it during the surgical procedure. I might have done the same procedure multiple times, but it's not the same patient and it's not the same case. So it's always different and you're always learning something new. I think that's what I love about it, is that I get to experience all this stuff that nobody else gets to experience on a day-to-day basis. Once you're changed for the day, you come out, go into the OR, you look to see what cases you're assigned. After that, we get our room ready. I assist with transferring the patient to the operating room table. A lot of people say that the surgical technologist is like the police of the OR. Our responsibility is to make sure that everybody remains sterile and that the field remains sterile to protect our patient from infection. A surgical tech needs to be very detail oriented. There's multiple people in the room that you're helping. So you're helping the surgeon. A lot of times there's a first assist or a PA or a nurse practitioner that's assisting the surgeon as well. There's a lot of multitasking going on. After the surgical procedure is done, usually I go around seeing if any of my other team members need help, if they're in a surgical procedure and they need a break. We work as a team every day and we count on each other. All of my team members, they were so willing to help me learn, and being a part of a team in the OR is really crucial. Schooling to be a surgical tech is only 2 years. When you graduate school, you're not automatically certified. You have to take the certification exam, and then you can be a CST, which is a certified surgical technologist. And then you have a career in healthcare that you can take anywhere. If you start off as a surgical tech, you don't have to stop there. You could go on to be a physician's assistant. You can go into nursing if you would like. You could also be a first assistant. So there's so many opportunities for you if you start with surgical technology. And you get to see something cool every day.